Welcome back to Radiologist. I'm your host, Dr. kam'mwamba. As you know, this is a podcast we talk about different health issues. Today we are here to talk about radiology. And as always, I'm always joined by an expert on every topic. Can you introduce yourself?
I'm Fortune Mwamkonda. I am a radiographer.
Okay, so my first question is, when we say radiology, can you explain what people mean?
Radiology in general means an officer in a hospital setting that is mostly trained to take images and using different kinds of imaging modalities for diagnosis sake.
So can you tell us what are your main roles as a radiographer?
A law for radiographer, mainly as in my case, mainly is to do general X-ray examinations. Also have to do basic ultrasound examinations. So in X-ray, X-ray which is general general X-ray, conventional X-ray, we can say. It will be not maybe, but it will be explaining the procedure to the patient, editing the patient, doing the examinations, and make sure that the patient is okay even before and after the examinations. If required, you do help with the clinical officers in interpreting the images. That is if it's required, but you are not supposed to do the interpretation yourself. You can actually chip in if they require your help, but some of it, there are a lot of them. Some of it is like that.
So for you, Agnes, what does a normal day for you actually? What what uh what are the tasks that you do like in a day for you?
In my setting, at a normal day, we doing general ultrasound examinations, which more of obstetrics for pregnant women, just to check in them a well-being of the unborn child. To check if the baby is okay, it's breathing fine, how many weeks it is so far, and it's the presentation. That of course the examination depends on what the clinical officer wants or the nurse wants. Sometimes it depends if you have a working X-ray machine, that means you also have to be doing X-ray examinations. But if you have more people, more radiographers, that means you share that. Someone will be doing ultrasound examinations, the other person will be doing X-ray examinations.
So what are the types of imaging procedures that you as a radiographer perform in the what exactly happens with this imaging procedure?
There are actually many of them. Some of them we don't practice them as we are not qualified to do so. But we have convection X-ray, which is general X-ray. We have ultrasound scanning. It actually uses sound waves to produce imaging, internal images, that is. And we have magnetic resonance imaging, which uses magnetics to provide internal body structures images for diagnosis. We also have computed tomography, which uses high dose radiation for diagnosis.
So as we can see, not everybody can be a radiographer. So what are the requirements that are needed for someone to be a radiographer?
In my case, the requirements is to have a diploma in general X-ray, but you can go as far as they are doing a degree in general X-ray, then will be a radiographer. Or you can also choose to do most degrees, they just call it, they generalize it as medical imaging. But I studied radiology in school, that is in National College of Medical Sciences. But we do have a degree course in mass medical imaging. They do general X-ray, they also do ultrasound scanning, like two different types of
So can you tell us what made you want to study radiology, or what made you want to be a radiographer?
Initially, I didn't want to be a radiographer,
Yes.
so I wanted to be a nurse. But as time goes, I discovered by chance people were discussing, oh, you know, people in Hakabanga, when you can say when an accident has happened, when they do go to the hospital, then they do X-ray examination center to see what happens in the inside. Like back then, I didn't understand that at all, but I just decided to try it and see what it is actually. As we started the first year, I started understanding it. When we started going to the hospital, then I understood it more. Then I actually started to enjoy it. I forgot about nursing.
Uh, so what are the type of what are the equipment that you use for your job?
The type of equipment that I use.
Yes. As a radiographer, what the equipment that you use?
Or yeah, me, we do use. We have an X-ray machine. It's for generic X-ray. That is it. We also have an ultrasound machine. So those are the ones that I can work with according to my qualifications.
So when you, so how do you use the X-ray machine?
Uh, so when the patient comes, they come with a request from their doctor. You actually assess the condition of the patient. As for using it, mostly it's you use it according as you are trained in school, since it's all like it's already connected and stuff. So you just look at the request, you see if it is a possible to do or something like that. Then you just position. It has like a machine which is standing upright. Then there's a table. You position the patient on the table. You adjust parameters. Then you go to the console and do the exposure. And then it's done. We are using a digital and it's computed. So we don't do the things of doing giving films like I should just say there are like different types of X-ray machines. Others are analog; they use X-ray films. While I think most of the time the ones that we are using, they are digital, they are computerized, so it's kind of easier to use. And the image is processed right away after you made an exposure. The image will appear right away on a X-ray monitor.
So how do you ensure safety for your patients when you are doing imaging procedures?
Patient safety mostly there are these it's, I can't say it's like categorized, but we do apply certain rules, not necessarily rules, but we do have one that is called ALALA. ALALA stands for as low as reasonably practicable. That is, I mean, ALAP, as low as reasonably practicable. Then there is ALALA, which means as low as reasonably achievable. So the other one mostly just guys who deal with I should say the risk benefit ratio. You have to measure, like since X-ray is the medical it uses radiation. So the radiation is dangerous. So you have to weigh, you have to measure the benefit of the patient to be exposed to radiation. You can see the request that the doctor made, then you can ask the patient just to confirm if what the doctor wrote is what the patient is feeling. So from there, you go on and weigh which one is more, which one will benefit. Will the patient benefit from this examination or not? If the patient will not benefit, we don't proceed with the examination. The patient might just end up getting more radiation instead of actual benefit from them. So we do suggest other modalities also depends on the examination. So if it was about abdominal pain, so we can suggest that the patient go for ultrasound scanning because it has no any dangers that is involved. The same as you also have to reduce the time that the patient is being exposed to radiation. The longer it takes it, the more the patient is getting radiation. The less it is, the less the patient is getting radiation. Also, we do the thing called the shielding. Make sure that the other parts that are not maybe the patient did fall down and they are suspecting a fracture that maybe is broken the bone or something like that. So you have to cover the other parts to make sure that it does not get radiated or something like that. And also have to make sure that the distance between the patient and the source is at least the higher it is. It should be recommended by the book. Sometimes it's 100 centimeters, sometimes it's 150 centimeters, depending on an examination. Others are the simple ones, like maybe a 100 say you can make the distance up to 100 centimeters. But for chest, you make it as high as 150 centimeters. The distance reduces the intensity of radiation. I can say it like that. Yeah, something like that.
So can you like tell us how do you explain your procedure to your patients?
Generally, you have to make it as simple as easy in a language that the patient understands. If the patient speaks Chichewa, you make sure that you explain the procedure to the patient in Chichewa, make sure they understand. Same as if they can't understand Chichewa, maybe they do speak Chitumbuka or Romwe, you find someone who understands the language and they help in explaining the procedure to them. Because if they can't speak or they can't speak or they can't hear, so we do request if they have a guardian with them, we ask the guardian to be in the room with them to help in interpreting what we are saying. Since I don't know sign language, so for me it's easier if the guardian does it, but just make sure that the guardian is protected from radiation. Providing them to have these aprons, or can say gowns, but they are made with lead. They kind of heavy, but they do protect you to unnecessary radiation, or can say scatter radiation. So yeah, something like that.
How do you handle if you are treating like a difficult patient? How do you handle that situation?
In most cases, if the patient is just maybe it keeps moving, it makes it kind of makes the images not to be perfect. That is in general X-ray. In ultrasound, not really much that in X-ray. The patient has to stay still for the image to be passed as something that can be used for diagnosis. The patient was moving, that you have to repeat the procedure until the patient was stable, it was not moving. So we do have to apply certain measures where we do have immobilizing devices, like you can strap the patient or even the kids. Most of the times the children are not very much obedient. So we do apply immobilization devices that helps them not make sure that the patient is not moving. If we don't have improvise, even the children works, you can use children, make sure that that part that we want to explain is not moving.
So how do you communicate with other health officials in the hospital when you have calling results? How do you communicate with them?
Communication, not really, I shouldn't say it differs, but in ultrasound, patient will come with a request form, you do the examination, you write what you have seen on the examination at the back of the request form or in the history passport. That's how you communicate with the doctor or the asking nurse. If it's in radiology, I mean, if it's in X-ray, you don't really do interpretations, as I've already said in the beginning. the doctors are already aware, everyone is aware that a radiography technician is not supposed to be giving interpretations unless they are asked to. So in our setting, we do the examinations, we write the patient's ID number on the health passport. That ID number is the one that the doctor will come whether to go, if he decides that like right now I should go maybe to look for the patient images. So he uses the number to search for the that particular patient's images. So as I said, it's computed. So it means we do send the images wirelessly, but we send them in different viewing points. We have set we have installed the viewing points in different wards. Each ward has its own computer where the doctor can go check for the X-ray results. So they use that ID in the patient's name to check for the patient's ID. Then they will see the results. If there is something that they don't understand, they will come back and they ask you. Then you can sit together, discuss, and come up with one solution or one diagnosis, I should say.
So how do you treat a patient that has special needs or has mobility issues?
With special needs, of course, it differs. If the patient can't move, so we have to help the guardians, the technicians who help in moving the patients either from wheelchair to the X-ray table or ultrasound table, from there back to the wheelchair. If the patient is disobedience, maybe they can't speak, you just make sure that the guardian is sticking around, interpreting whatever you are discussing, you want to convey to the patient. And that is the patient gives responses. The guardian will tell you, he understands it. If you are giving commands, he will tell you why, he will do it, stuff like that. If the patient is uncooperative, maybe they do have mental issues, but they need to certain examinations. Let's just say he needs abdomen X-ray or chest X-ray, which requires the patient to stay still, not to be moving around. You do ask help from the nurses. They can actually. So we do have a psychologist in the hospital. They can help in maybe negotiating with the patient. If the patient is actually difficult as maybe the nurses are aware, they do sometimes bring back, we'll send the patient back, and they will bring back the patient maybe after their babies, after they have slept, we will do the examination while they are sleeping. But the adults, if they really need the examination, maybe they will just give them a sleeping medication or a medication that will have calming effects so that the patient will not be moving around.
So, what are the main challenges that you face on your job?
Challenges, they all differ in hospitals, but most of the times maybe shortage of staff, shortage of the geographers, I should say, most of the times. And also most cases, we don't have, we are supposed to be having sonographers who are supposed to be doing ultrasound examinations, but in Malawi, they have just recently opened that kind of course. So the radiography technicians, the radiographers are the ones who are in charge of doing the ultrasound, even though we are not trained to do that. So it's kind of a challenge if you miss certain things that maybe you don't understand, you can't interpret, you don't know what it is. So you have to refer the patient to, which is not an ideal solution, of course. And the most, as I also say, it's not a shortage of staff, but it depends. If there are no staff, that means you have to take on more responsibility, whether it's doing ultrasound examinations, doing X-ray examinations, registering patients, and stuff.
Oh, and how do you handle the situation whereby the imaging results might be different from what maybe the patient phone will happen?
Like maybe it's different from what the doctor were expecting.
Yes.
So it does happen sometimes. maybe the clinician will be suspecting that this patient, the way it is looking, maybe he might be having certain issues. Maybe the results will come. It's just maybe how should I put it? Maybe the results differs to what the doctor was expecting happens, but patients represent their sicknesses differently. One will come looking healthy and stuff, we will do their examination, maybe chest x-ray, we will find out this patient is very sick, maybe as sick as was he supposed to be, maybe bedridden, but in his mind or in his physical condition he's just looking fine. So if in that case, we see doctors coming back and say, I think you have confused this patient with another imaging, another patient's images. In most cases, we have to do bad, not most of the times. To avoid such issues to occur most of the times, we make sure that we do proper identification. Other patients, maybe because of we do have a lot of patients in the hospital, so they will be feeling like maybe that they want to go home faster. They will actually respond to other people's names, so they can be helped faster and then faster. So in that case, you just make sure that the patient should state their name, and their name should be matching with what it is written in the health passport. And also we do ask the questions like, how are you feeling, what is the problem, what is explaining, what the patient is explaining, at least match what the doctors has written. It's kind of different. We reach out to the doctors to avoid having issues of repeating examinations or maybe misplaced identities and stuff. Back then when we are using analog examination, analog X-ray, we would write a patient's name on the film before processing it. So the film, after processing the film will come with the patient's name. So most of the time we never have issues of misplaced identities and stuff, unless when you were writing the name, you confused with another maybe patient's tag. But in this time we are using computer, you actually asking the patient's name, so you write it on the computer and everything. So most of the time it doesn't really happen, but if it does, that means you have to repeat the examinations, or if not, maybe the clinician was just maybe was expecting something bad or something good, you actually explain to them everything else that went down. But if there comes a time that they really need to confirm the identity or the identity of the images, then we have to redo the examination after explaining to the patient.
Thank you very much. So, as you have seen, we have come to the end of our program. This was Radiologist Health. Today we talked about radiology. We learned a lot of things about radiology, and I hope this will help everyone else. I'm your host, Dr. Kam'mwamba, and I was joined by
Fortune Mwamkonda.
and until next time, this was Radiologist Health.